PNCR calls for investigation into $100,000 cash grant distribution. The People's National Congress Reform, PNCR, has called for an investigation into the distribution of the $100,000 cash grant to Guyanese citizens, citing a series of controversies surrounding the process. The party expressed concerns over criteria that they claim humiliate citizens and gather data for the People's Progressive Party/Civic, PPP/C, ahead of upcoming elections. The distribution has been plagued by chaotic scenes at various sites, with allegations of corruption, including reports that some individuals received checks intended for others, and instances of individuals receiving the grant twice. At a press conference, PNCR General Secretary Sherwin Benjamin stated, "Permit me to here and now call for a complete investigation into the entire arrangement of the cash grant." He emphasized the need for transparency in the disbursement process. Executive member Ganesh Mahapal echoed these sentiments, questioning the lack of transparency in the system. He criticized the government's method of collecting personal information and photographs, only to have issues arise during distribution. It begs the question as to whether there is really transparency and accountability of the system of this cash grant, he said. In response to the ongoing issues, Vice President Bharat Jagdeo announced that the Ministry of Finance has been instructed to simplify the distribution process. He acknowledged confusion caused by individuals showing up at distribution sites without processed or printed checks. However, opposition MP Coretta MacDonald criticized the vice president's instruction as being too late. She argued that a proper plan should have been established from the outset to prevent the confusion that has led to long lines and distress among vulnerable populations, including senior citizens and pregnant women. Furthermore, MacDonald condemned the government's requirement for recipients to be photographed holding their checks, calling it humiliating and an unnecessary burden on citizens. She asserted that the photographs are intended for propaganda purposes ahead of the general and regional elections, stating, "There is absolutely no justification to further humiliate and belittle citizens in this way." The PNCR is urging an immediate end to this practice, labeling it disgraceful. According to government statistics, 545,000 checks have been processed, with approximately 200,000 Guyanese having received their grants, while a much larger number has registered for the program. CNOOC and China Medical Team donation enhances GPHC with advanced surgical imaging system. The Georgetown Public Hospital Corporation, GPHC, has received a state-of-the-art surgical imaging system, marking a significant advancement in medical collaboration between Guyana and China. The 4-CMOS fluorescence endoscopic camera system, known as the ICG Fluorescence Laparoscopic Tower, was officially handed over by CNOOC Petroleum Guyana Limited, CPGL, and the 20th China Medical Team from Jiangsu Province. Dr. Navindranath Rambaran, GPHC's Director of Medical and Professional Services, praised the donation as a substantial enhancement to the hospital's capacity for advanced liver and laparoscopic surgeries. He noted the enduring support from Chinese medical teams, recalling that GPHC's first complete set of laparoscopic equipment was also donated through this partnership in the early 2000s. This signals a continued relationship with the China Medical Team and the People's Republic of China, said Dr. Rambaran. He emphasized the technical assistance and training provided to local doctors as part of this collaboration. At the ceremony, CPGL President Mr. Lien Jihong reaffirmed the company's commitment to improving medical standards in Guyana. CPGL is proud to sponsor this project and help uplift medical standards by ensuring that more patients in Guyana can benefit from advanced surgical procedures that are safer and more effective, he stated. Lien expressed gratitude to the Chinese embassy for its support and coordination, as well as appreciation for GPHC's professionalism. He highlighted CPGL's establishment of a special medical assistance fund to support vulnerable patients and its ongoing sponsorship of training for Guyanese doctors in China. Chinese Consul General in Guyana, Li Hanqing, described the handover as a significant milestone in the medical collaboration between the two countries. This underscores China's dedication to showcasing medical innovations and supporting Guyana's healthcare development, he remarked. This donation follows an agreement established in 2024 between the Chinese medical team and Guyana's Ministry of Health, facilitating the introduction of cutting-edge medical technology to the country. Dr. Shailendra Rajkumar, GPHC's head of general and plastic surgery, expressed gratitude for the long-standing partnership with the Chinese medical team, which has evolved over 3 decades from providing services to equipment donations and educational opportunities in China. The introduction of the new fluorescence imaging system represents a significant step forward in improving patient care in Guyana, enabling local surgeons to perform more complex and precise procedures. Both CPGL and the Chinese medical team emphasized that this initiative is part of broader efforts to strengthen Guyana's healthcare infrastructure and promote sustainable developments in medical services. Over 8,000 meters of sea defenses to be built this year. The Guyanese government is set to construct approximately 8,000 meters of sea defense structures across the country, with an allocation of $8.2 billion in the 2025 budget. This initiative is part of a broader strategy to diversify agricultural infrastructure while focusing on climate-smart development. During the Guyana Energy Conference and Supply Chain Expo at the Marriott Hotel in Kingston, Georgetown, Minister of Public Works Bishop Juan Edgehill announced that over 110,000 meters of sea defenses are currently being maintained nationwide. He emphasized the importance of these structures in protecting agricultural lands from saline water. In recent years, about 23,900 meters of new sea defense structures have been constructed along the coast. The funding for this year will facilitate coastal defense projects in key areas such as Belladrum, Bengal, Den Amstel, Onderneming, and Zeelandia. To further enhance drainage and flood management, the government is also building over 200 kilometers of drainage canals in Regions 5, 6, and 2. In collaboration with the National Drainage and Irrigation Authority, the Ministry of Agriculture has installed 19 pump stations along the coast, complementing 40 mobile pumps that are ready for deployment to outlying areas. Minister Edgehill underscored the significance of these efforts in support of the PPP/C administration and CARICOM's food security agenda. He noted the goal of reducing the CARICOM import bill by 25% by 2025, highlighting the need to keep saline water off agricultural lands. Additionally, the minister discussed other infrastructural projects aimed at enhancing transport and logistics, including the potential establishment of a deep water harbor. Although a final decision has yet to be made, he indicated that the government is considering a railway system to facilitate the movement of containers from the proposed harbor to Lethem and northern Brazil. Edgehill emphasized that rail transport remains the most economical option for moving goods, which could significantly drive economic growth. Overall, these investments are designed to diversify the economy and improve connectivity across the region. Afro-Guyanese seen only as vote bank by WPA, PNC, Jagdeo. Newsroom. Vice President Dr. Barrett Jagdeo has accused the Working People's Alliance, WPA, and the People's National Congress Reform, PNC/R, of viewing Afro-Guyanese merely as a vote bank, instead of recognizing them as individuals with their own interests and aspirations. At a press conference, Dr. Jagdeo responded strongly to recent controversial remarks made by WPA member David Hines, which he condemned as disgusting. Hines had referred to Afro-Guyanese who support the governing People's Progressive Party/Civic, PPP/C, using derogatory terms such as house slaves and lick bottoms. Dr. Jagdeo, echoing sentiments from President Irfan Ali and Minister Gail Teixeira, expressed dismay that Hines' leader, Aubrey Norton, had not condemned these inflammatory comments. He criticized the notion that Afro-Guyanese are seen as unthinking and easily manipulated, stating, "The WPA and the PNC treat Afro-Guyanese as though they are unthinking, easily manipulated individuals." The vice president highlighted the positive developments among Afro-Guyanese, noting an increase in Afro-Guyanese-owned small businesses securing contracts. He emphasized that these individuals are not selling out, but are making informed decisions based on a pursuit of opportunities rather than blind loyalty to any party. Dr. Jagdeo also scrutinized Hines and the WPA's past, accusing them of betraying their leader, Dr. Walter Rodney, who was murdered under the PNC government in June 1980. He questioned Hines' silence during the previous administration's actions that negatively impacted the Afro-Guyanese community, such as the removal of children's grants. David Hines had a cushy job during the last government, Jagdeo remarked, adding, "But did he once speak up for the Afro-Guyanese community?" He pointed out that between 2015 and 2020, when Hines and other WPA leaders were in power, they failed to advocate for the interests of Afro-Guyanese. Dr. Jagdeo criticized the WPA and PNC for lacking vision and concern for the future of young Afro-Guyanese. "Why would anyone want to align themselves with a party that has done nothing for them?" he asked, emphasizing that individuals are making smart choices based on opportunities rather than racism or oppression. People have choices. They are not sellouts, they are simply making smart choices.